Hi there, my name is Kim Haddad, and this is a brief overview of the canine weight management study that I hope you will agree to participate in. It's about a 10-minute video, and I thank you in advance for your time. We all know that there's an awful lot of overweight and obese pets, and that the problem is only getting larger. In the United States, there are more than 100 million overweight or obese dogs and cats, and it's considered one of the most common and most important chronic diseases in dogs and cats. We also know that excess weight can reduce our pet's lifespan and has a negative impact on their quality of life. In fact, obesity is considered the #1 nutritional health problem for dogs. And while there are many contributing factors to this, some important ones are lack of owner awareness, many not even knowing that their dogs are overweight, that many clients make poor choices in terms of what they feed their dog, how often, what they give them for snacks or treats, and sharing human food with them. Many of our canine patients don't get enough exercise, and when we put together weight management programs, many clients just don't seem to follow our recommendations. And we all see clients with pets like this in our hospitals every day. And while there are an awful lot of overweight and obese cats as well, this study focuses just on our canine patients. So why this study? Well, again, we know it's an important veterinary medical issue, but it's also a very important animal welfare issue. We also know that many owners have no idea how to get their pets to lose weight. And we, as veterinarians, are often very frustrated by lack of client compliance. We have a lot of difficulty getting any kind of accurate information from our clients about what or how much they're feeding their pets. And so all of these factors contribute to the fact that what we're doing just doesn't seem to be working very well. A recent survey showed that 80% of veterinarians and 68% of pet owners have tried to get pets to lose weight. But these weight loss outcomes are often very disappointing. Most animals do not gain or do not lose weight or reach their target or ideal weight. And if they do, they tend to regain that weight back relatively quickly. And so the number of overweight and obese pets continues to grow. So the primary objective of this study is to answer the research question as to whether integrating a smartphone weight management application will result in greater weight loss in overweight and obese dogs compared to what we're currently doing. The study has been approved by the VSA Clinical Studies Institutional Review Board. So for veterinarians to participate, you need to have a smartphone and be interested in weight loss for your patients, and agree to monitor your patients for any change in their medical condition during the study, as well as engage with our clients, with your clients during the study as well. Clients must also have a smartphone and be interested in weight loss for their pet, and they need to agree to the enrollment criteria and participate for the study duration. Our canine patients to be included must be 12 months or older, and they can be male, female, intact, or neutered. Having a body condition score using a scale of 1 to 9 of anything above 5, using whole numbers, so anything 6 and above considered overweight. They need to be current on their veterinary examination, have a valid veterinary-client relationship. They must have normal lab test results within 6 months of enrollment, and they cannot currently being treated for any serious chronic disease. So exclusion criteria, so any dog with an underlying severe medical condition such as heart disease, respiratory disease, kidney disease, and the other conditions listed here, or any medical reason or any condition that you as their veterinarian believes would make a weight loss program unsafe for that patient. Clients that are unwilling or unable to utilize a smartphone app would be excluded, and clients who don't believe their dogs are overweight or have no interest in weight loss for their pet would also be excluded from the study. Once in the study, clients can withdraw at any time for any reason. Other withdrawal criteria would be if a participating patient is diagnosed with a chronic disease during the study period that would make weight loss dangerous for that patient. If the patient is injured or requires invasive surgery or orthopedic surgery, or any other procedure that would require an extended period of recovery, would be removed from the study as well. And again, for any other reason that you as the veterinarian feels it's not healthy for that patient to continue. So to begin the study, veterinarians must sign a consent to participate. And you'll also be asked to complete a survey which details your current weight management protocol. Owners will sign an informed consent to participate form. And then there are data capture forms where the information will be collected on each patient. And then at the end of the study, there are client and veterinarian surveys. So to determine the participants using electronic medical records, overweight and obese dogs fitting the study criteria for enrollment have been identified at each participating VCA hospital. Clients will be invited to participate, and once their enrollment is confirmed, patients will be randomly placed into one of two groups. Regardless of which group they're in, they will have an initial examination, and that information will be captured into the data capture form. So group 1, again, will have the initial examination. That information will be collected in the data capture form. This group will receive a link to download a free app and register. And the client will, once registered, enter their pet's information, the current weight and body condition score that you will provide them with, as well as enter in all the current diet information into the app. The app will do calculations to determine how many calories their pets are currently eating, and based on their body condition score and current weight, will make caloric recommendations. And then the client will use the app to log their weight and activity during the study period. Group 2 will have the same initial examination, same information collected, and you'll make your usual recommendations for ongoing monitoring, and all the updated weights and diet changes and body condition scores, etc., will be captured in the data capture form. So the study design is based on the American Animal Hospital Association 2014 and 2021 weight management nutritional guidelines, with a rate of safe weight loss being between 0.5 and 2% of their weekly body weight. The weight loss calculation is based on the resting energy requirements of the calculation shown here, with a 20% reduction of the current daily caloric intake as a starting point. So again, this is just a brief timeline overview. So 500 dogs will be identified with the expectation that 300 will participate. Clients are invited. They'll be sorted by their veterinarian, we sorted to each veterinarian, and then will be randomly placed into group 1 or group 2. They'll have their initial examinations. You'll make your weight management recommendations. And then during the study period, weights will be updated at least monthly during the study period, if they'd like. Group 1 will do so using the app, and they can come into the hospital. And group 2 will follow your usual recommendations with all weights entered into the data capture form. The study period ends July 31st, and there will be an end of study exam with information collected into the data capture form, and then a post-study survey will be completed. And these are just example to show you the data capture form. So the first column is information of that initial examination, information about the client, the hospital, the patient. The middle column is their diet information. And both of these forms are to be completed at the initial examination, so gathering as much diet information as you can. The third column is where weights will be input throughout the study. And these are just some screenshots of the app. So the first screen is where they would register and create their free account. The purple screen is where they enter information about their pet, so pet's name, breed, age, current weight, body condition score, etc. The blue screen is where they would go and log their weights. And then the green screen is where they would input information about what their pets are currently eating. And this here is just, again, the VCA Clinical Studies team, super helpful. This is their contact information should you have any questions during the study. You can also reach out to me. My information is at the end of this presentation. So again, I thank you so much for your time, and just a reminder of just how wonderful it is when our overweight and obese pets achieve their target weight. It's life-changing, and I hope you agree that this is a hugely important problem and that you will agree to participate in this study. Again, I thank you for your time. Please feel free to reach out to me at my email or my cell phone number here. I will be in touch soon, and I look forward to working with you. Thank you again, and bye for now.